Hello everyone. Let me introduce my PhD topic in mobile motion analysis. My name is Azamat Bissenov. I am PhD student in Department of Orthopedics in Semmelweis University. My vision is high quality health change behavior and personalized medical care for disabled people. To pursue of this vision, my mission is clear: to promote widespread use of mobile motion analysis system for easier diagnosis and the more accurate treatment of musculoskeletal disorders. There are two specific goals related to my PhD topic. Today we will talk about first two. My first topic is titled Investigating the Validity of Inertial Measurement Unit on Gait Parameters in Ambulatory Individuals. The gait is complex motor function that involves coordination of multiple body systems. And the impairment of gait is particularly common in several diseases such as osteoarthritis, cerebral palsy, and the stroke survivals. Except the clinician eyes, the gold standard nowadays to assess gait parameters is 3D motion analysis system, which is known for its accuracy and reliability, but usually associated with higher costs and the technical complexities. In this case, alternative system inertial measurement units, by shortly EIMU, which is known for its cost effectiveness and portableness, which makes it more accessible for a wider range of population. Because of this, my aim evaluates the validity of inertial measurement units for motion tracking. In this picture, you can clearly see this both system. 3D motion analysis system requires dedicated place with specialized camera, also requires experienced staff who can perform this analysis for individuals. Inertial measurement system, alternative system, it's user-friendly, cost-effective, portable system. Even patients can perform their gait analysis by themselves. So from this, my clinical question arises. Does EIMU have clinically acceptable validity in measuring gait parameters? My population, ambulatory individuals, my index test EIMU, reference test 3D motion analysis system, diagnosis of interest, gait parameters. My hypothesis, EIMU technology demonstrates comparable validity in capturing gait parameters. My systematic search was conducted in 4 databases in 2023 with 4 domains. Approximately 15,000 hits was found. By narrowing it down, 23 articles was chosen for review. My outcome measure root mean square error, which is important in biomechanical studies, which usually show difference between alternative system compared to gold standard. If root mean square error high, it indicates the error is high, which indicates less accuracy. If root mean square error is low, which indicates better accuracy, it means error is low. In my study, we investigated range of motion, 3 joints during the walking, especially ankle joint, knee joint, and the hip joint in sagittal plane. During the walking, for example, in ankle joint, different range of motion occur. For example, if the ankle joint move towards the shin, it's called dorsiflexion. If ankle joint move towards the floor, it's called plantarflexion. The sum of this movement called range of motion. So we measured range of motion by EIMU and the 3D motion analysis system and check the level of error by root mean square error. So my first outcome, ankle joint angle in sagittal plane. Outcome measure root mean square error. Outcome units angle. Root mean square error may vary from 0 until infinity. So for overground walking, root mean square error was 4.15, which is less than acceptable accuracy 5. For treadmill walking, root mean square error was 5.46. Overall root mean square error 4.62, which is less than acceptable accuracy. So my second outcome, knee joint angle in sagittal plane with similar outcome measure, with similar outcome units. Pulled root mean square error 4.81 for overground walking. For treadmill walking, pulled root mean square error 4.19. Overall root mean square error for both type of walking 4.93, which is less than acceptable accuracy. My third outcome, hip joint angle in sagittal plane with a similar outcome measure. Pull root mean square error for overground walking 5.80, for treadmill walking 6.94, pull root mean square error 5.79, which is out of reasonable limits in biomechanical studies. So the strength of my meta-analysis in systematic review, it will be first study for Gait kinetics, and we followed strict methodology, and we hope we didn't miss any relevant articles. Limitation of our study, inconsistent methodology was used between articles. Because of this, heterogeneity is high. In conclusion, EAMO-based gait analysis system can show acceptable validity in measuring in knee and the ankle joint. In practice, it allows to perform gait analysis system where 3D motion analysis system is unaffordable because of higher costs. Also, it allows clinicians to assess gait parameters in out-of-laboratory condition. Implication for research, EAMO system should be evaluated more because root mean square error in hip joint is high, and for knee joint it's almost 5. So currently I am writing my manuscript, and I am writing my supplementary material. My second project is called Evaluating the Validity and the Reliability of EAMO for Balance Assessment. Balance is important during the walking to maintain proper balance. It saves you from falls and the injury. Also, it allows you efficiently and the energy safely walk. And the damaging of balance is particularly common in neurological and the musculoskeletal disorders. The gold standard to assess balance is force plate, which requires traditional 3D motion analysis laboratory. Alternative system also EAMO. So my aim of this study to assess the validity and the reliability of EAMO in balance assessment. In this picture, you can see this both system, which I previously shown, force plate and the EAMO. My clinical question, how valid and reliable are EAMO in assessing balance compared to force plate? With similar population, ambulatory individuals, EAMO referenced as force plate outcome of balance parameters. I hypothesize EAMO measurement will be reliable in the clinical acceptable, valid compared to force plate. So by this, we want to improve accessibility for balance assessment tool. So my second project is feasible. Currently, I almost finished my Prospera protocol. In summary, we hope that I will finish my first project in October 2024, and the second project in March 2025. So I would like to say thank you for your attention and finalize my presentation by Hippocrates quote, walking is man's best medicine. Thank you.
Thank you for the presentation. I wanted to ask, is there a reason why the root mean square was, regarding the first study, was higher in the treadmill walking compared to the ground walking?
Thank you for your question. Root mean square error was high in treadmill walking compared to simple overground walking because if you walk in treadmill, it will alter your natural ability to walking. In different speed may be used in treadmill, and because of this, it show high difference compared to overground walking.
Thank you. I have a question. What are the, in general, challenges of this methodology, the IMO?
IMO, because, first of all, thank you for question. Because you cannot directly derive information about joint angle from EAMO. From EAMO, you can directly assess acceleration, angular velocity, but to assess joint angles, you should use algorithms, like calculation methods. Because of this, it may show errors. It's first challenging from these methods.
And what about calibration?
Calibration also, it's in both systems, calibration is important, even in EAMO, in the 3D motion analysis system.
I also have a question for you. So these IMUs are relatively small devices, right?
Yes, it's small.
So are these, could you use these outside of a lab laboratory setting where maybe the issue of balance is a bigger problem than inside of a lab? Could that be an additional applicability even if the validity is somewhat lower?
Can you repeat your question? I don't understand.
So if IMUs are small portable devices that don't need a lab, would you be able to use them to assess the patient in situations that are more similar to real life?
Yes, you can use in out of laboratory condition. It's first advantage. It's not like very small. It's like a little bit bigger. You can apply for yourself. Even in athletes nowadays using to assess the acceleration, angular velocity. This methods.
That's a great answer. Do you think that this would somehow allow you to accept a bigger deviation from the truth?
Because of this, it's acceptable accuracy until 5, and sometimes they say it's maybe 2, but until 5, it's okay. But if it's out of 5, it's unacceptable.
Okay, so the 5 is already factoring that in.
5, yes.
Okay, thank you.
Sometimes 5, sometimes 2, but usually 5 in more research.
I see. Thank you.